It is estimated that 1.8 million Nigerians live with HIV. Nigeria has recorded great improvement as access to anti-retroviral drugs and treatment for HIV has increased. There is still that big challenge of stigmatization and discrimination in our society. Precious Edoja, an epidemiologist, runs through the big wins and challenges faced. Thav TV urges stakeholders and partners to address the issue of equal access to treatment and prevention services.
Okay, my name is Precious Edoja. I am a public health practitioner and I'm an epidemiologist. I've practiced for more than 6 years currently. This is actually my 6th year active practice in public health.
Okay. So how has the experience been for the past 6 years in Nigeria?
It's been amazing because it comes with the driving force is actually passion. So, and I would like to let you know that I've majored basically on the HIV program for the past 6 years. It's been amazing seeing that your passion is driving you to saving lives, bringing interventions to see how epidemic can be controlled.
Okay. So when you got the first, appointment to be under the HIV/AIDS umbrella, how did it feel?
Initially, from where I'm coming from, my first degree, for instance, it's more like I was completely a novice to see. But with time, as time goes on, I realized that apart from it being lucrative, it's also very, very interesting. You see that this is more like an everyday lifestyle. Tend to meet people, interact with people, find out their problems, create solutions, help them, support them. And again, it's knowing that you're going to bring people out of a certain state to a state that they never imagined they can be, probably because of the myth about everything surrounding the scenarios. So it's really been interesting.
So what was your first experience when you first met a HIV patient?
My first experience, okay, let me say my first experience when I first met an HIV patient who is wasting. Yes, because you could meet HIV positive people, or rather people living with HIV who are healthy and they are thriving in the sphere of life where they found themselves. But when you meet the one that is wasting, there's this thing, this empathy. Then coming with the knowledge that you already have, knowing that, oh, it can be controlled without getting to this stage. So why wait to get to this stage? The truth of the matter is, if you get to meet an HIV patient who is wasting, you feel really bad, because ignorance is what makes an HIV patient get to that stage where they begin to waste. And that's the AIDS stage, no longer an HIV stage.
Wow. Okay, now, what do you people, or what are your job roles?
Okay, let's start from currently the HIV program has 3 aspects, and they are called the 95, 95, 95. Now, the first 95 is to ensure that people get tested. I'm not going to bore you with the percentage of people. So just on that 95, 95, people get tested. And 95% of people who are tested know their HIV status and they are linked to care. And 95% of patients who are linked to care are virally suppressed. Now, what that means is there is the testing aspect, there is the treatment aspect, and there is the viral suppression aspect. So the viral suppression is just saying that, which is more like the last aspect, it's just saying that, oh, since you knew your HIV status and you're HIV positive and you were linked to care, ART, anti-retroviral therapy, you've been linked to care and be taking your drugs and you are doing well, no missing of drugs and everything is fine. And then the viral load test is done and you're virally suppressed. Virally suppressed in Nigeria is actually people whose viral load sample are below 1,000. Now, there's something called undetectable equal to untransmittable. The people who are living with HIV, who are virally suppressed, who are currently undetectable, are untransmittable. What that means is if the virus cannot be detected in your bloodstream, you cannot transmit it to another person. So that's how epidemic control is achieved.
Okay, now, in Nigeria, there is a whole lot of stigmatization. Okay, what do you make out of that?
Okay, in 2015, thanks to President Goodluck Jonathan, who was the president of Nigeria at that time, who passed the act of discrimination against people living with HIV. Now, that act says that people living with HIV should not be discriminated. And that means that even you cannot say you won't get a job because of your HIV status. As a matter of fact, nobody who is supposed to employ you should ask for your HIV status result or ask you to go and do a test. So that alone, there's an act against people, discriminating people living with HIV. So stigmatization per se is, whether we like it or not, we are human. And some of us are second judges. Permit me, we have the book of Judges in the Bible, but this particular set of us, we are the second judges that are not in the Bible. So they tend to judge. And I believe that stigmatization comes from ignorance. If you truly know about HIV, you will know that stigmatization shouldn't even be there, because people who are living with HIV are healthy people. They are still healthy, just that they are infected with a virus that does not have a cure. So stigmatization is one thing that has really made people to shy away from getting treatments. And this treatment is free of charge. It's free of charge. So when you stigmatize, and funny enough, the worst case of stigmatization is self-stigmatization. So when I have HIV, I'm stigmatizing myself. That is the worst case of stigmatization, because I'm not even giving myself the opportunity to know that, oh no, this is not how it is. If I go out there, I can meet people in the same HIV community who are living well, and I can be able to talk to them, get idea, clear my doubts, clear my myth, clear whatever misconception I have about HIV, and then live a healthy, positive life. So self-stigmatization is the bedrock of HIV, and that is also the reason why people waste. It's one of the reasons why people waste, because they stigmatize themselves. They begin to exclude themselves from the society. They are bottling up a lot of things. They are not mixing with the society. So with that, they just remain in one place, and before you know, they're wasting.
In Nigeria, what are the major causes of having HIV?
Okay, not major cause per se, major root of being infected with HIV. Yeah, there are basically 4 ways someone can get infected with HIV. Now, before I go, let me let you know that HIV is a human immunodeficiency virus. This virus attacks the immune system, and is more like body. The immune system is body soldiers. So when I have those soldiers, for instance, surrounding me, and there's an alpha force that is coming to attack, that immune system is supposed to defend me, so that body soldier is supposed to defend me, so that I don't get that force coming to attack me. That force coming to attack doesn't get to me. So that's how the immune system works. But the virus, HIV virus, is a very stubborn virus. So if that virus is able to break that fence of defense, right, and get into the system, it begins to gradually eat up the immune system. Until it's, and if treatment or intervention is not put in place as soon as somebody gets infected, or when you do your test and you are positive, that's when it begins to deteriorate and get so bad. It may also interest to know that somebody can be HIV positive for as long as 15 years without symptoms. Yes. So HIV on its own, the first stage is asymptomatic. There are no symptoms. It is when it begins to get to second stage, third stage, and fourth stage, where it's more like the wasting stage. That's where symptoms begin to come. So people can live with HIV for as long as 15 years. Some 6 months, and they begin to get symptoms and all of that. Now, going back to your question, there are different ways somebody can get infected with HIV. One of them is unprotected sexual intercourse. You know what that means? Having sex with a person who is HIV positive without using protection. And then for those who also have multiple sexual partners without using protection. Then another way is through the use of unsterilized sharp objects, such like razor blades that is not sterilized, a cortical remover, needles, unsterilized sharp object. Then the third way is through on-screen blood transfusion. So for instance, if you have somebody who is sick in the hospital and needs blood, and they bring me, who is HIV positive, for instance, to donate blood to that person, if my blood is not properly screened and is given to that person who needs blood, automatically the person gets infected. And then the last one, which is more like our focus at the moment in HIV program, is prevention of mother-to-child transmission. So a pregnant woman can actually give the HIV virus to her child. A breastfeeding mother can also do that. Then a child can also have it through labor and delivery. So what that means is PMTCT, prevention of mother-to-child transmission, or MTCT, mother-to-child transmission of HIV, is mother giving it to the child through labor and delivery, through breastfeeding, then during pregnancy. Now, it may also interest you to know that women who are HIV positive, who delivers, are advised to exclusively breastfeed their children for 6 months. Exclusive breastfeeding means no water, without formula. Only breast milk for 6 months. Now, you may want to wonder, even that with the virus not in the blood, in the breast milk? Yes. But the thing is, the child digestive system is tender. Now, breast milk is more like, the fluid, the liquid is thin, more like water. Now, if you do only that, there are no injuries on the girth. The child is not going to have the virus. But when you begin to give breast milk and give other foods, remember that other foods, their particles are bigger, they are thicker, so they could cause injury to the girth. So when you do that and still give breast milk, the child could have the virus. So that's where we see through breastfeeding. So like I mentioned, through unprotected sexual intercourse, unsterilized sharp objects, on-screen blood transfusion, and then mother-to-child transmission.
Okay, thank you. So what then happens when you detect that a patient or somebody has HIV? What happens from there in our health sector? Yeah.
Okay, yes. What happens it starts from testing, counseling and testing. Now, when I get an HIV positive client who is knowing his or her status for the first time, of course, there's a lot of psychological and emotional breakdown that will come up. But then, through proper counseling, you can bring the person to a balance, letting them know that getting to know that you have HIV, first of all, is an achievement, honestly, because you could live with it without knowing. It's an achievement. Now that you know your HIV status, that you are positive, you have to first of all take what we call the risk reduction plan, so that you don't end up transmitting this virus to the people who are around you, to your loved ones, spouse, possibly children, or when you want to, or if you're not married, you can actually get married, but there are risk reduction plan. But for the person who is HIV positive, person is linked to treatment, anti-retroviral therapy. So this therapy has to do with a certain drug that the person will take for life. For now, it's still for life. And this drug is free of charge. So all you need to do is to calm down. get to know your status. Accept your status when you are given the correct first results, and then start your treatment. The moment you are on treatment, you are safe. Nothing is going to make the person deteriorate to the wasting stage, which is the 8th stage. So just start treatment. That's anti-retroviral therapy. It's a drug that is given for life, actually, and it's taken once daily. It's even good now because in the past, as far back as early as 2017, there were these drugs they give. One, you take one morning and night. You take a certain drug morning and night. Then there's another one you take only at night. But the current drug right now is taken only in the morning. And you can take it without food. So you will not tell me that because you don't have money to buy food or you're hungry, it's why you are not able to take your HIV medicine. It's as easy as that right now. Just wake up in the morning, swallow your pills, and you're good to go.
Okay. In the event that an HIV patient stops taking these drugs or shies away from coming for medical checkups, what then happens?
Okay. Now, that's a very interesting and a very realistic question. Now, there are people, the drug is for life, and we are humans. We get tired. There are certain reasons why a patient will stop taking drug, possibly, or stop coming to the health facility to access treatment. First of all, proximity to health facility. Maybe the place is too far, and the person does not have transport to always come. Secondly, attitude of healthcare provider could also make the person shy away. But most importantly, it could also be the person forgets to take the medicine, or the person even get tired. It's not easy taking a particular drug for life. So the patient may even get tired. Whatever wants to happen, let it happen. So those are some, although there are much, but that's just some of the reasons why a patient may stop taking drugs or come to the facility. Like another thing is stigmatization. Then another thing could be denial. Yes, you could accept to take the medication while I was talking to you or counseling you and you leave the hospital. But you will get home and decide that, am I really sure? Are you sure this thing is not spiritual? HIV is not spiritual. It's real, it's not spiritual. So like I told a patient one time, even if HIV is spiritual, why not try using the physical means we have already told you to see if it will work? So HIV is not spiritual. So like I mentioned, the reasons why a person may stop taking drug: self-denial, proximity to healthcare facility, attitude of healthcare provider, forgetfulness. Then person could actually be discouraged, just give up. Whatever wants to happen, let it happen. Then stigmatization.
How do you guys take care of when it comes about, when religion and faith comes in way of people from not taking their drugs and all that?
That's a very big problem. Religion, faith is a very big problem in HIV treatment. To be honest with you, religion is a big problem because you are tested HIV positive and you say, I'm going to pray to God. God will heal me. I'm not disputing the fact that miracle happens. I'm not. But while we wait for the miracle, let's do what we are presented with. Because the same God who is going to bring that miracle to pass is the same God who has given the wisdom for this intervention to also take place. And trust me, HIV treatment is easy. It's easy. So religion and faith, funny enough, some of these faiths people end up coming back to take this same intervention that we presented them initially. They still come back. Because it is even faith to take that drug for it to work for you. That's what I believe. It's even faith to take the drug for it to work. So religion really comes in the way of them. But then, through proper counseling, we can also be able to help them know that while you are waiting for the miracle, still be doing this. And you can also let them know that even God said that it is the work of your hand. So you have to present something that he will he will use. So why not present this for him to use? So that's that.
Okay. Now, do you have any case study with respect to somebody being stigmatized and the person made away and they don't return back again?
Of course. And there's a lot of confidentiality around HIV care. So we are not permitted to actually mention name or show people. But stigmatization, yes, there are cases of people who you didn't see them for a while and you begin to call them. And sometimes they don't pick your call, sometimes they pick your call. Then for some of them, when they are able to talk to you. So that's why it is important that when you encounter an HIV patient for the first time, HIV client for the first time, you need to make the person trust you and you need to be trustworthy. So you are the first point of trust the person gets to meet. So that in case there is anything going on that you are not aware or you will not be available to know, to witness, the person can always come back to you and say, this is what I'm going through. I don't know if you get it. This is what I'm going through. Yes, stigmatization. You know what? Stigmatization is evil. It's evil. We're even talking of HIV, that way, hey, HIV pouring away. Let's look at these new cases of divorce and all of that. How stigmatization makes people. So if I'm not sick, I just left a relationship and I'm already being stigmatized. Let's look at it, saying that somebody have HIV. It's evil. And seriously, it can actually make somebody commit suicide. Because it can result to depression. Yes, there are cases, but we're not permitted to mention names or even create such scenarios. But there are cases. And please, if you're hearing me and you know somebody who has HIV, stigmatization is not a solution. It's demonic. The best you can do is support. If you can't support, face front. Now, this year theme for the World AIDS Day, which is 1st of December, it's equalize. Now, this equalize is more like an outcry. It's like an outcry to me, to you, to everybody, for us to be able to identify the disparities among people living with HIV and bringing an end to HIV. So we need accessibility to HIV treatment, testing and prevention for everybody. Equal access to the marginalized, to injectable drug users, to same-sex, to everybody, to the orphans and vulnerable. So this year, let us learn to love one another, whether HIV positive or not. The way you love me, let it also. Don't say because I'm HIV positive is why you can't talk to me. No. So let's show that care. Let's help one another. And I keep telling people in HIV treatment, the HIV person you help today is one step away from it getting to your family. Because it's close. It's close to home. It's close to home.
Okay. Are you shocked with the data, the increase of HIV in Nigeria? Does it shock you?
It doesn't really shock me at the moment, but because it's coming down. Yes, it's coming down. If you listen to Mr. Ali, okay, let's not go there. As of 2019 to now, there's a decrease because there's a lot of intervention currently ongoing. People are not sleeping. Non-governmental organizations, they are not sleeping. It's an epidemic. We need to control it. So it's really coming down. In the past, we hear of states like Akwa Ibom, like Benue, where they say the prevalence is high and all of that. Today, what's happening there? It's down. The viral suppression in Benue is marvelous. Same with Akwa Ibom. And these were the states, they say, HIV. So in other states where we still have high prevalence, there are non-governmental organizations there who are trying to ensure that this epidemic is controlled.
Okay.
So I'm not shocked.
Okay. So there is this common say that Benue people, Akwa Ibom people, they like sex too much and their lifestyle does not help them. Reason why HIV is high in those states. Can you make anything out of that? Could it be?
I mentioned earlier that people who are second judges. Yes, lifestyle can actually be a risk factor to having HIV. Lifestyle can be, but sex is not the only way somebody can get HIV. Sex is everywhere in the States. It's everywhere in all the states. You won't tell me that people don't have sex. They do. But like I mentioned, sex is not the only way somebody can get HIV. You can get it from barbing salon, hairdressing salon, from these people that cut nails along the road. You can get it from there. Like we mentioned, unsterilized sharp objects, blood transfusion. So what do you say to an 8-year-old child who just got infected with HIV and the parents are negative? So what do you say? Is it sex? It's not. So that could have been unsterilized sharp objects or even blood transfusion. So their lifestyle, yes, lifestyle generally can be a risk factor. And when we mean lifestyle, we're talking about promiscuity and possibly having multiple sexual partners can be a risk factor. But then we should also know that there are other ways somebody can have HIV. So that you don't see a Benue man has HIV, say, this one I think is true sex. No. That's not always the case.
Okay.
That's not always the case.
Lastly, with respect to government, what do you think they should do better in Nigeria?
Currently, the government of Nigeria have done well. First of all, by opening their doors for this intervention to come in. Yes, I can applaud them for that. And this has been going on for years. It's not now, for years. Then non-governmental organizations too, they have really done well. So, but what I think that the government can do better is education. Enlighten the people. Yes, NGOs are doing that. Everybody is working to ensure that, this person gets informed about HIV. But I think if the government, and the government is also doing that to enlighten the people, but there are hard to reach communities. There are islands that the government knows these places. So if the government can reiterate this education, they can use media houses. They can go to those hard to reach communities where we know that possibly they may not be listening to news. But mind you, there are places where you go to, they're listening to radio. At least. So if the government can also leverage on media houses to ensure that the news about HIV testing, HIV treatment, HIV prevention is passed across to those areas, it can also help to curb the rate of stigmatization among people living with HIV. And then it can also help to increase prevention. So people begin to take care of themselves. That this can happen if I do this. Because I'm sure there are still places where the news of HIV have not reached. And even if it gets there, they'll tell you there is Obanje. They'll tell you there is witchcraft. They'll tell you there is jazz. Somebody throw something for me. But I asked the clients one time, how many houses do you have? None. How many cars do you have? None. What's in your bank account? Madam, leave that. I said, no, I want to know the reason why somebody would decide to give you HIV. Because you are like that. So, my dear, it's not witchcraft. It was contacted from somewhere.
Thank you very much.
You're welcome.
Thank you.